NeuroQuant Brain Tumor is a fully automated, FDA-cleared brain tumor segmentation tool that provides volumetric information on high and low-grade gliomas, metastases, and meningiomas. It's an excellent tool for disease surveillance, offering longitudinal data to monitor patients over time and evaluate their treatment response. Each tumor will have its own input series requirements for NeuroQuant brain tumor processing. Each tumor type will also have its own AE title destination that the technologist will send the images to in order to generate the appropriate report. In this demo, we'll walk through 3 examples: glioma segmentation, meningioma segmentation, and metastatic disease segmentation. For glioma segmentation, NeuroQuant Brain Tumor requires 4 input series, a 3D T1 pre-contrast, a 3D T1 post-contrast, a T2 weighted sequence, and a T2 flare sequence. These are all part of a standard brain tumor imaging protocol, so no additional imaging is needed beyond what's in a standard clinical workflow. As we scroll through these input images, we'll see that the patient has a large mass centered in the septum pellucidum. On the T1 pre-contrast, the mass appears hypointense. On the T1 post-contrast, there's bright gadolinium enhancement, indicating active tumor. The T2 and T2 flare demonstrate edema and flare hyperintensity in the surrounding tissue. Now we'll review the corresponding segmentation series and report. NeuroQuant automatically segments 4 key tissue types in glioma cases. Flare hyperintensity is shown in yellow. Enhancing tissue is shown in red. Necrotic core is shown in green. And then if this were a post-op patient, the resection cavity would be shown in blue. As we scroll through this example, you can clearly see that each tissue type is distinctly color-coded and delineated. Now let's review the glioma report. The top section includes demographic information for the patient, including patient name, referring provider, patient sex, date of birth, and patient ID. In the report information section, it provides information on scan date and NeuroQuant Brain Tumor software version. And then the site information will include information for your site. The middle section provides lesion visualization images showing the tumor in its largest dimension. And then the bottom section, which is really the most important part of NeuroQuant Brain Tumor, provides quantitative information, including whole lesion volume in cubic centimeters, as well as enhancing tissue volume in cubic centimeters as well. In this case, the patient's enhancing tissue is 17.94 centimeters cubed, and their whole lesion volume, which includes enhancing tissue, necrotic core, and flare hyperintensity, is 42.98 centimeters cubed. Now that we have evaluated a single time point glioma case, we'll now review the patient's 1-year follow-up exam. We have the input images for the first time point in the top row and the input images for the 1-year follow-up in the second row. As we scroll through these images, we can see that there is some increased gadolinium enhancement on the T1 post-contrast, as well as what appears to be some tumor progression into the left periventricular region. There's also some increased edema and flare hyperintensity in the surrounding tissue, and we can really appreciate that flare edema expansion as we continue to scroll through the images. We're now going to review the patient's glioma segmentation results from the prior time point and the 1-year follow-up, with the prior time point being on the left, 1-year follow-up on the right. As we scroll through the segmentation series, we can see that there is definitely some increased flare hyperintensity segmentation, as well as enhancing tissue and necrotic core. We're now going to review the corresponding reports for the prior time point in the 1-year follow-up study. The follow-up report will closely resemble the structure of the single time point report. We have demographic information at the top, a tumor visualization section where we show both segmented and input series in the greatest dimension of the tumor. Then we also include longitudinal tracking graphs to track enhancing tissue volume and whole lesion volume across time points. In the x-axis of the graphs, we have the date of the MRI, and in the y-axis, we have the volume of the corresponding tissue in the graph name. In this particular case, the patient's first time point had an enhancing tissue volume of 17.9 centimeters cubed. With their 1-year follow-up, they had an enhancing tissue volume of 23.9 centimeters cubed. For whole lesion volume, in the first time point, it was 43 centimeters cubed. And then in the 1-year follow-up, it was 122.7 centimeters cubed. Down at the bottom where we have our quantitative measures table, we give current and prior volumes as well as percent change. In this case, we can see that the enhancing tissue volume increased by 33.17%, and whole lesion volume, which includes enhancing tissue, necrotic core, and flare hyperintensity, increased by 185.43%, which correlates to our visual assessment of tumor progression. As you can clearly see, this is a wonderful tool for a longitudinal assessment of tumor progression. The next case that we're going to evaluate with NeuroQuant brain tumor processing is a meningioma patient. The input requirements for meningioma processing include a 3D T1 pre and post contrast. As we scroll through this patient's input images, we can see that there is a mass that's hypointense on the T1 pre-contrast and shows gadolinium enhancement on the T1 post-contrast. This mass is just to the right of midline and appears to be falcine in nature. We're now going to evaluate the segmentation series next to the T1 contrast enhanced image. For meningioma segmentation, we segment and color code necrotic core and enhancing tissue. As you can see in this particular case, the entire tumor is color-coded in red, which signifies enhancing tissue, meaning that there is not a necrotic core with this tumor. I'm now going to evaluate the NeuroQuant brain tumor meningioma report. This closely mirrors the glioma report with a couple small changes. We still have the demographic information in the top section, and then tumor visualization images for the input images as well as the segmentation images. And then at the bottom, we have our quantitative measures table with information on enhancing tumor and tumor core, which is enhancing tumor plus necrotic core. In this case, the enhancing tumor is 3.21 centimeters cubed. The tumor core is also 3.21 centimeters cubed, meaning that our software did not detect any necrotic core and the tumor is strictly enhancing tissue. We're now going to evaluate this patient's 2-year follow-up exam. In the top row, we have the first time point. In the bottom row, we have the follow-up exam. We're going to compare the inputs between the 2 time points. When performing a visual comparison between the post-contrast images of the prior time point to the follow-up study, it's a little difficult to appreciate if there are incremental changes or if there are significant changes, which is where our segmentation and the corresponding report will really come in handy as we evaluate those subtle changes. We are currently reviewing the follow-up report for our meningioma patient. On the right, we have the multi-time point report. On the left, we have our first time point. You can see that the multi-time point meningioma report closely resembles the structure of the single time point report, with the addition of a longitudinal tracking graph where we are tracking enhancing tissue volume across time points. In the x-axis, we have the MRI date. In the y-axis, we have the volume in centimeters cubed of the enhancing tissue. In the quantitative measures section, we give current and prior volumes, as well as percent change. In this case, the first time point for both enhancing tumor and tumor core was 3.21 centimeters cubed. The follow-up volume for enhancing tumor and tumor core was 4.25 centimeters cubed, resulting in a 33% increase across a 2-year time span. You'll notice that again on our second time point, we did not detect any portion of the tumor to be a necrotic core. It's still strictly enhancing tumor. Longitudinal reports are particularly useful in patients with slow-growing tumors like meningiomas. We can objectively quantify those small, subtle changes over time that can be difficult to visualize with a qualitative assessment. In the last part of this demo, we'll be discussing NeuroQuant Brain Tumor Brain METS reports. There are 2 input requirements for our METS model, which include a 3D T1 pre and a 3D T1 post. I'm going to show you a multi-time point study today of a very compelling case. We have the first time point pulled up on the screen now. I'm going to begin scrolling through the images, and as I scroll through the images, we can see that there's some gadolinium enhancement in the vasculature, but nothing is segmented as a lesion. And then when we look at the report to the right, we can see there's a summary table. It gives information on number of lesions, number of new lesions, and total lesion volume. Of course, all of these numbers are 0 since there were not any lesions segmented on the T1 post contrast. And then we have a lesion analysis table that would typically list out the lesions and their volumes, and then whether they're new, enlarging, shrinking, or stable. We now have the patient's second time point pulled up on the screen. This was actually a 6-month follow-up from the prior exam. I'm going to begin scrolling through the segmentation series. As you can see, things have changed quite a bit. There's several areas that were segmented as lesions. It's important to note with our METS model that we segment enhancing tissue in red and necrotic core of the tumor in green. So as you can see, several different areas were identified. And then in looking at the report for this time point, we can see within the summary table that 12 lesions were segmented. All 12 were new from the prior time point. The total lesion volume is 7.72 milliliters. The number of resolved lesions for this particular case is 0, and the volume change is also 7.72 mLs. And looking at the lesion analysis table, we have the lesion number, the lesion location in terms of axial slice that the lesion is best seen on, the volume of each lesion, and the lesion status, whether it's new, enlarging, shrinking, or stable. In this case, of course, all of the lesions are new from the prior time point since none were identified on the first time point. So this longitudinal tracking aspect really illustrates the value of this product and how much it can make a difference in patients that are changing rapidly, because we're really quantifying that information objectively. As you have seen today, NeuroQuant Brain Tumor provides automated, objective, and reproducible volumetric measurements for brain tumors and treatment response monitoring. Instead of relying solely on visual assessment or manual segmentation, which can vary across readers, NeuroQuant helps standardize the process, helping to reduce variability, save time, and provide data you can confidently use alongside clinical judgment.